Thank you. So the majority of the messages that will now be shared with you is stemming out of the work from the work package 7 that is acting on fostering the quality of care in prevention and care for people with chronic diseases that are led together with Marina Maggini's team from National Institute of Health from Italy, and with a lot of partners in 8 pilot action sites. But we were asked actually to show what such kind of work can mean in the context of national policy development and implementation. Rolling out the Chrodis Press results on national scale cannot be done without teams actually working on the field, and this presentation was prepared together with the team in the General Hospital Novo Mesto and Primary Care Center Novo Mesto that are rolling out the actual pilot action implementation. So Slovenia, of course, challenges the same problems as other countries, although we have only 1/3 of population of Singapore and almost the same population of Budapest, so 2 million only, but problems are the same. And we, by tradition, have very strong primary care, and it has been additionally strengthened from 2011, when we, in addition to the nurses and specialists in family medicine that are working on primary care from 1920, started to add registered nurses to every team that are acting as care coordinators for chronic diseases, and they also do the prevention visits that are in place from 2002. Additional money was also given to the teams for the lab exams and so on, but the most important change was the structure of the primary team in Slovenia on national level. Of course, this strengthening of primary care is based on the analysis we performed together with OECD and WHO Observatory just before we decided for these actions. And we aligned all these ideas and actions into the National Healthcare Plan for next 10 years. One of the problem defined and with additional solutions, of course, are the horizontal as well as vertical integration of treatment in our healthcare system. It is insufficient, so even if we added the registered nurses into the primary healthcare teams, then we knew that we need additional new approaches actually that would more include the communities at the prevention centers at primary care. So we are actually now in the evolution of these prevention centers, and this evolution will start after 5 years. So more and more and more activities is performed on primary care, and this horizontal integration is one of the tasks that is very, very time-consuming, and should be culturally sensitive, you know, because doctors, nurses, institutions have actually different cultures, and we've heard that from today. But what we also need to do is to integrate everything that is going on the primary care level with the secondary care level, where the hospital and outpatient care is managed. And we, in this National Health Resolution, have already the measure and specific objective related to integrated and comprehensive treatment defined in a project for the integrated approach to patients across the entire treatment process. And we also have to that related one impact indicator, so the report. And this is when joint action Chrodis Plus comes in. Of course, before Chrodis Plus there was Chrodis, so before Chrodis Plus it was Chrodis. And Chrodis, of course, developed quite a lot of principles, tools that are used also in this rollout in Slovenia. And it was defined by the Ministry of Health in line with the National Health Resolution that a model for integration of care across primary and secondary level for specifically complex state or disease should be developed, including also social care. And this was recognized as a very so important step at the national level, so that even in the Chrodis Plus, we are really receiving the major support from the Ministry of Health, and it was seen also, for example, during the study visit in Slovenia. So what are we doing as other partners with pilot actions? We are using the joint action Chrodis recommendations and set of criteria to develop a model, and we are basing, all three teams working in Slovenia, are basing this model on the exact experience of the patient. So we have really meaningful patient involvement there, developing the before and after scenario that will actually be representing one part of the model for the future use in Slovenia. So really the good description of what should be done. But we are having in mind also the leadership, because the leadership, to come to the bottom line, it has to really be a complex leadership, and we are advancing in all these criteria that are defined in this tool. So currently, this is only one part of the pathway that the actual patients experience when travel across primary and secondary and social care and family. So this is only a part. And the team is working really hard until now, and until now they decided, they came actually to these solutions, much less different points of entry to the secondary care, and of course it is still under developing. And as I said already, it is done in Novo Mesto, where the General Hospital and Primary Care Center are working on that. Not only this is where Slovenia is involved, we also decided to take the opportunity and analyze the National Healthcare Plan strategy against the Joint Action Chrodis multimorbidity or integrated care model that will be a little bit more presented, I think, by Graziano in next time. So we will take the two documents and see what is in there, what is missing, and only doing the comparisons, it will not change anything. So this will be the actually input material for the policy dialogue that we are doing in work package 4. So now we have 7, 6, and 4 about the policy dialogue and integration of care, where we will define the action plan with further steps for spread of the model developed in the Novo Mesto across the healthcare system. So we are again, doing the loop together with the concrete pilot action result. And what we are mostly afraid of, so to say, sustainability, scalability, and spread of joint action Chrodis Plus result in this case really has to support the Slovenian context. So when we are strong, when we are asking questions, it's not only because we want all the best for the joint action Chrodis Plus sustainability, but for Slovenian sustainability of the change that has to happen at systemic level, and it is of structural nature. And I'm sure that you know how it's really hard to come to the structural changes. So many successes of Chrodis Plus in our working group work package are dedicated to the use of joint action Chrodis recommendations and set of criteria. Can be, of course, found at the posters, so please visit us, talk to us, make us think about the issues that we may not maybe think until now. And I am now just want to assure you that from each pilot action, there is already a sustainability link to the national health system, because the pilot actions are implemented and changed during the PDSA cycle in a way that it can really be meaningful for their own countries, so that it will become part of the live nature of the change in their respective healthcare system. So come and visit our posters. Thank you.